the role of TCM in fighting against the virus. With us today is Mr. Huang Luqi, leader of the Medical Treatment Expert Group of the State Administration of TCM, Academician of the Chinese Academy of Engineering, and Dean of the Chinese Academy of Chinese Medical Sciences. Mr. Tong Xiaolin, leader of the Medical Treatment Expert Group of the State Administration of TCM, the Administration of the Chinese Academy of Science, and the Chief Researcher of the Chinese Academy of Chinese Medical Science. And Mr. Zhang Zhongde, Deputy Leader of the Medical Treatment Team of the State Administration of TCM, the Deputy Director of the Shandong Provincial Hospital of TCM, and leader of the second National TCM team. Friends from the media, good evening. TCM is the assets of China, and we experience all different kinds of difficulties, and we overcome the difficulties. Also need to give the credit to TCM. Since the outbreak of the epidemic, we firmly implement the instructions made by General Secretary Xi Jinping, and also we better utilize the role of TCM, also leverage the advance of TCM, and also better utilize the TCM and Western medicines. And we would like to inform you the updated information. First, we make the plan of TCM. At the very beginning stage, the state administration of TCM sent 2 groups of experts to Wuhan to make a field visit and also look at the patients and organize a team to compile the prescriptions and also make technical plan in TCM prescriptions. Second, we organize a national team of TCM. We organize the Guangdong TCM institution, Beijing TCM institution, and also Beijing, Jiangsu, Hunan, Zhejiang. Altogether, we organized 3 teams with 344 experts to support Hubei. 1 team in Wuhan Jinan Hospital, 1 team in Wuhan, the TCM and Western medicine hospitals, and 1 team for Jiangxia shelter hospitals that operated this afternoon. We sent 2,220 people from a TCM system. A lot of them had rich experience in battle against SARS. And we also have the rotation team and to support Liangshan Hospital. And third, we make our efforts to treat patients. The TCM teams, with the support of localities, we would like to emphasize the role of TCM, and we received the confirmed patients suspected 248, 159 patients cured, and also have the 22 patients removed from the ICU. And based on our clinical manifestations, the patients with mild conditions, they have the symptoms such as the hard of breathing that's very quickly been cured. And we have the patients quite satisfied with the result of TCM, and we also summarize our lessons and learnings through the treatment. Right now, we look at TCM actually participate in the treatment of at least 75% of all the therapeutic plans, and for the other regions, the rate is 90%. We believe the role of TCM can play even a greater role in this regard. For the centralized quarantine places, the patients stay at home or in the centralized quarantine places. We give 5 prescriptions and also the 3 Chinese soups with herbs. Right now, we already given out 110,000 prescriptions. And going forward, we will firmly implement the plans and arrangement made by the CPC Central Committee and State Council, and we will also leverage the role of TCM and also increase the cure rate, and also resolutely win the battle against the virus in Hubei and Wuhan. Thank you. Thank you, Mr. Huang Luqi. Now the floor is open to questions. Please identify your media affiliation before asking questions. With Xinhua News Agency, the patient quite welcome the TCM to participate its role and what we can expect from TCM medicines. And what is the best timing for TCM to get involved? I would like to give the question to Mr. Tong Xiaolin. We talk about patients hospitalized. They first came from the quarantine places. A patient right now in quarantine, they from a community. So talk about TCM, we should be involved at a very earlier time, and also should we get into the community level, and also should be involved from the end to end throughout the whole process of treatment. We hope we can cure or find the disease at the very beginning of an epidemic. We talk about actually TCM is for precaution, and we also make a preventive measures. And for this disease especially, we talk about close contacts. So this group of close contacts means they have the direct contact with confirmed cases. So we first need to give them the precaution treatment, and we should prevent them from contracted virus. So at the very beginning, we should give them the TCM, make sure they're not transmitted from the mild symptoms to severe symptoms. And later on, we also use the combination of TCM and Western medicine to lower the mortality rate. And also at the recovery stage, that also should let TCM to play a bigger role. We talk about they actually have a deficiency of vital energy in the lung and the spleen. We talk about a traditional way, like the food, and also a mental cure, and also talk about the acupuncture or the hot cups, all can play its role in the recovery period. But we talk about the patients or the public not have enough knowledge about the TCM and also its effectiveness. So they not really use the TCM in the very beginning. So we should first educate the public so they will not panic and not question about TCM. So let's say if you contracted with TCM, so you should go to the TCM at the very beginning. And Mr. Tong already gave a very good answer to the questions. So talk about the role of a TCM, I believe, in the following 5 areas. First, at the very early stage, we should let the TCM to play a prevention role. As we know, at the very beginning stage, have the symptom of fever, coughing. Sometimes people think it's just normal influenza. So for the patients stay at home for quarantine, we suggest them to use a prescription of TCM. For the patient in the centralized quarantine places, they have the symptom of normal coronavirus. Then we also have the symptoms in this regard to shorten the disease period and also prevent them moving from the mild symptoms to severe symptoms. For the critical patients, we would also like to emphasize the role of TCM and also proved at our work in Jinan Hospital. So we actually give the patients with Chinese and Western medicines that also help them to shorten the time in terms of the oxygen therapy. So we save 2 days for patients not using respiratories. So we also at the later stage, say the patients with critical illness, they cured and discharged from the hospital. They lost their appetite and also have the inflammation in their lungs. So we also give the patients at their recovery stage. So we give the patients and also pay the visit to the patients at the recovery period, and their satisfaction rate is above 70%. So which means the majority of our patients quite satisfied with the effectiveness of TCM at the recovery stage. So we talk about the precaution prevention of the disease by utilizing TCM, and also can use TCM to help them to improve their immune system. So which means let them have more positive or vital energy inside the body. You can play Tai Chi or normal exercise to strengthen your body. And also we talk about the Chinese food with herbs. That's also some quite fine traditional way to protect or strengthen your body. And also during this time, we have a quite deep learning, which is the public. They have a quite urgent needs for TCM. When they start to take TCM, that also help to ease their panic or nervous. So based on our clinical survey, 80% of patients with critical symptoms, they would like to receive TCM treatment. 90% of patients with mild symptoms, they would like to take TCM. For patients in quarantine, they would like TCM to play its role in a very early stage. All these shows that TCM can play its role in treating the disease, and I believe these 5 areas already prove the benefits. With Renmin News Agency, the 3rd, 4th, 5th protocol of prevention and control of disease all include TCM. I would like to know the practical treatment of TCM. I believe this is something that people are quite concerned. So talk about the treatment with mild symptoms. It can really quickly cure the patient with mild symptoms. It helps them to get rid of the heat and help them to increase their appetite and also help them to get rid of fatigue. And it quickly can show its benefit. For the patients with critical condition, so first we look at the cure the symptoms. First, we cure them coughing or the chest pain, dyspnea, fever. And also prevent the patient from severe condition to critical condition. And also you can see TCM have a higher possibility to help the patient with severe condition to mild condition. So for our observation, the Guangdong team, we found in the previous 2 weeks, we received 116 patients, 85 with severe, 14 with critical, 8 with mild symptoms, and 41 been cured. 19 is already discharged, and 22 actually meet the standard of discharge, are right now coming to the recovery place for further observation. So you can see that really help the patient to shorten the time of treatment. Thank you. I would like to add on to the question. I also can show you a set of numbers. In Jinan Hospital, we treat a patient with critical condition. As of today, the noontime on February 14th, the Chinese medical team, we in charge of 42 beds and admitted 86 patients, 65 severe condition, 21 mild condition. We have right now 33 people discharged. We give only TCM to 8 patients. We talk about the combination of TCM and Western medicine plus only give the TCM or only give the Western medicine to patients. We look at the patients use combined. They quickly show a good sign in their NAT and also quickly improve in their symptoms such as the fever or coughing, and also look at their lymphocytes, also improved compared to the group only with Western medicine, and also very quickly help them to increase their appetite. My question is, right now we make all-out efforts to treat our patient. This is our priority. And also, based on our observation, we have looked at the patients that discharged from the hospital with the TCM and Western medicine. Can you talk more about the benefit of TCM plus Western medicine? I would like to give this question to Zhang Zhongde. So this is a good combination of treatment. So we give the injection, the pills of TCM, or the traditional way like the acupuncture to give the patient. We also rescue the patients, and we help to buy some time for the patient with critical symptoms. And talk about Western medicine, so we use multiple ways to save our patients. And we also help them to save them from the shock, from the respiratory dysfunction. Like the TCM and the Western medicine play this synergy, and we shorten the cure rate, lower the mortality rate, and also shorten their days in the hospitals. And also, this is a really good combination, I can tell you, from the clinical manifestation. It's CCTV. Talk about besides giving the prescription of TCM, what else we have used and what's the effect? As you mentioned, playing Tai Chi. And we also look at inside the shelter hospital, we have seen the patients playing Tai Chi. And what's your feedback? And my question goes to Mr. Zhang Zhongde. Right. In the inpatient ward, we practice the TCM ways. We talk about the acupuncture. We talk about the cups, and you can see actually the patient in the quarantine. They sometimes really hard to sleep. They really not sleep all night, and they quite hard to eat. They lost their appetite, and also they have the abdominal distension. And we give all these ways of TCM and help to mitigate their symptoms. We talk about the Tai Chi actually help to improve their immune system, and this is also quite beneficial. Zhutian Daily. In quarantine places for medical observation, they also take TCM as they required. So what's the benefit they can get for people in quarantine? So talking about patients in quarantine, that include 4 types of people. First, close contacts. And second, patients with fever. Third, suspected cases. Fourth, novel patients with mild symptoms. So talk about the early stage of prevention and treatment. The TCM can show its strength. For close contacts, use a TCM prescription, they can play a role in terms of precaution or prevention. We help them to strengthen their body, so the damp evils will not get inside their body. So we talk about all these actually help to maintain their vital energy and prevent the evil, the cold evil or damp evil get inside their body. So for the suspected cases, cannot rule out their possibility of confirmed patients. We give them the A5 confirmed TCM prescriptions to help them lower their temperature. So they may just have the flus, the influenza A or B, or the early stage of novel coronavirus. All these medicines actually help them to lower their temperature. So for the suspected cases or for the patients with mild symptom, so we use a large scale of the prescriptions for typhoid fever. So basically, we should find first what is the cause to trigger the disease, and then we will use the prescription for symptomatic treatment. Right now, this is used in a larger scale. So far, it's received really good results. People really like this medicine, and they really come to us to ask for the medicine. And they sometimes, our patients moved from the quarantine place to shelter hospital, they also would like to bring the TCM prescription with them. We talk about symptoms like fever, coughing, or coughing with phlegm, the fatigue, hard of breathing, lost appetite, diarrhea, anxiety. All these are the common symptom of novel coronavirus, and TCM, we can tell, is proved that help to mitigate all these symptoms. So the patients quite welcome TCM. Phoenix TV. Right now we have more than 6,000 patients cured and discharged from the hospital. We talk about the patients with underlying disease or elderly patients cured from coronavirus. Can we talk about how TCM can play its role in recovery period? What kind of the hint you can give to these group of people? So talk about the TCM and help to strengthen the lung function, and we have a quite matured prescriptions. We also have tell them how to really breathe, inhale, exhale, the respiratory exercise, and we talk about how to really get rid or get the phlegm out. We have all these practice that help the patient to strengthen their lung function and improve their living standard. And we also have the approved effects in this regard. We also have patients in the hospital. I gave them the TCM at their recovery stage and also give them the practice. We have a set of matured practice and techniques for patients in their recovery stage. I believe TCM can play its role in this regard. One last question. It's Chang Jiangyun. On February 13, the CBC Central Committee of Political Bureau emphasized TCM should larger its role in treating patients with novel coronavirus. Talk about how can let the TCM enlarge its role. I think they can consider in two parts. First, we should let the TCM engage more in treating patients. We talk about the percentage right now is 75% in Hubei Province. In other provinces right now reach 90%. So I believe there still have a room here in Hubei. So we hope Wuhan City and Hubei Province and have the supporting policies and targeted measures to let the TCM can treat more patients confirmed or suspected. And second, and we should increase the treatment or therapeutic quality and effectiveness. Talking about the combination of TCM and medical Western medicines, we have the requirements in this regard. We should work with the doctors from Western medicines to work out a technical plan to better treat our patients and lower the fatality rate, and also lower the number of patients from severe condition to critical condition. I believe these are the two considerations to let TCM better play its role. Thank you, all the guests, and thank you, all the friends from the media. And that's for today's presser. Thank you.